Patient's Perception of the Physician's Medical Terminology by Claire Hickner, Alex McElrath, Megan Lossos, Cassie Denny, and Michael Sinclair. In a study done by Hall, Roeder, and Rand in 1981, they found that the amount of disclosure a patient reveals is largely affected by what is said and how it is said by the physician. Relationships between patients and physicians develop when each individual can fully open up and reveal themselves to one another. Disclosure is the amount of information a person wants to share. A study found in the Communication Research Reports by Wang and Bowen in 2014 discussed how, in a medical context, patient satisfaction, trust, and disclosure indicates effective patient-physician communication.
Theory, which suggests that people adjust their behavior during interaction to become more similar or different. D'Agostino and Byland in 2014. CIT proposes that people accommodate their communication to gain approval and set a positive image in front of the person they're interacting with. Doctors can use this theory to imitate and understand the way their patients communicate in order to satisfy their communication needs. D'Agostino and Byland, 2014. As physicians consult with their patients about medical conditions, certain tones in their voice can be perceived as patronizing from the patient's perspective. Furthermore, physicians speak in the voice of medicine, using medical terminology and objective descriptions to describe physical symptoms. Adequate versus inadequate medical terminology. Inadequate medical terminology is the overuse of vocabulary typically known by a person who has intensely studied the medical field. Adequate medical terminology is appropriate vocabulary for those who do not have a firm understanding of the medical field. On the contrary, research suggests that the patients understand more non-technical terms and needs to feel like their voice is being heard. According to Charles in 2000, a patient will be dissatisfied with the experience if he or she feels misunderstood. Ben-Sura, 1976, suggests that knowledge inequality commonly exists between physicians and patients, which demonstrates that patient satisfaction is likely affected by effective components of communication style, as cited in Swelland, 2012. Research shows that an understanding of the patient's perception of a problem and its social and emotional impact is an essential part of the physician-patient interaction. Shaw, Ibrahim, Reed, Usher, and Rollins, 2008. Therefore, studies conclude that the physicians need to make sure the patient fully understands the information concerning the treatment because it is not always a perfect fit for that specific patient's needs and concerns. Our study looks at a physician's inadequate or adequate use of medical terminology and the patient's perceived willingness to disclose. This allowed us to determine if medical terminology had an effect on people's perceived willingness to self-disclose information to their physician. We then analyzed the results and tested our hypothesis. Perception of the physician's overuse of medical terminology will result in decreased patient willingness to self-disclose compared to perceived adequate use of medical terminology.
The method we used to was the convenient sampling method. We implemented this method by recruiting students from our COM 2010 class via email and Facebook. Participants were given a link to the questionnaire through a post that said, "Please take our survey for our COM 2010 class. It should only take a few minutes." Participants were also directed to the questionnaire by obtaining our class list and sending out a mass email to our classmates with the link provided. In total, 124 people attempted our questionnaire. Of that, 58 participants were eliminated because they failed to complete the questionnaire. This led our sample size to be 66 participants, 18 being males and 47 being females. Participants' age ranged from 18 to 78 years old. Materials. The participants each received one of two conditions randomly selected by Qualtrics. The first condition shown here depicts an adequate amount of medical terminology, while the second condition was an overuse of medical terminology. The procedure. Participants to our Qualtrics questionnaire through the links provided by us via Facebook or email. By Clicking the link, students were able to access our questionnaire. First, they were informed to read the condition that was chosen at random by Qualtrics. Next, the participants were asked to answer questions based on the condition they were given. These questions were based off of a 5-point Likert scale. 2 questions pertained to age and sex, while 2 questions were reverse coded. The survey took around 1 to 2 minutes to complete. Our experiment is a between subjects design. This is because each participant partakes in one group. The results from each group are then compared to each other to examine differences and thus the effect of medical terminology has on the willingness to disclose. We're asked to read one of 2 conditions, one of which depicts a physician's overuse of medical terminology, while the other demonstrated appropriate language for those not familiar with medical terminology. Qualtrics was used to randomize the scenarios, and the participants were then asked to answer questions regarding their perceived willingness to disclose information based off of a 5-point Likert scale. We formed our scale by modifying the Gerard 60-item self-disclosure questionnaire by Sidney M. Gerard and Paul Lesakow, 1958. Either they agreed or disagreed that they would disclose personal medical information to a hypothetical doctor. A 5-point Likert scale was implemented to assist the participant in answering the questions to adequately measure their level of disclosure. Each question was formed by 5 aspects, ranging from 1 equaling I strongly disagree to 5 equaling I strongly agree. For examples of the questions provided to the participants to measure the amount of disclosure were, I would be willing to discuss my family's medical history with this doctor, or with this doctor, I would not want to discuss my personal health background. These questions were essential when trying to gather information regarding amounts of disclosure. All of the questions provided through Qualtrics to the participants were used in collecting results. We utilized reverse coding for 2 of our questions, question 3 and question 8. By running a reliability test, we were able to determine that our Cronbach's alpha was 0.933. This shows that our scale is reliable because our Cronbach's alpha score of 0.933 is considered excellent. Our overuse of medical terminology condition was seen by 29 participants, while our second condition, which used an adequate amount, was seen by 37.
Overuse of medical terminology will result in decreased patient willingness to self-disclose compared to perceived adequate use of medical terminology. An independent samples t-test was conducted. Results indicated that the patient's perceived willingness to disclose information was significantly lower with physicians' overuse of medical terminology. M equals 3.24, SD equals 0.90, than physicians' adequate use of medical terminology. M equals 3.64, SD equals 0.88, T64 equals negative 1.80, and our P equals 0.04. Thus, the hypothesis was supported. This was conducted through an independent samples t-test that indicated a strong relationship of which the results were statistically significant. Our hypothesis is one-tailed, therefore we had to divide the given significance in half to find the P. Our new result was less than 0.05, which makes it statistically significant. Our results were reliable because of Cronbach's alpha was 0.93. None of our questions had to be deleted while analyzing the data because of our excellent scale. Summary. Concluded that our hypothesis was supported and discovered that there is a negative impact on the perceived willingness of a patient to disclose information to their physician depending on the amount of medical terminology used. This tells that the increase of a physician's use of medical terminology has a negative impact in the patient's perceived willingness to disclose information. Therefore, if a physician speaks to their patient with an adequate amount of medical terminology involved, it will increase a patient's willingness to self-disclose information. Implications imply that the perceived willingness of a patient to disclose information is negatively related to a physician's overuse of medical terminology. A patient's willingness to disclose will fluctuate depending on the amount of medical terminology used by their physician. There may be a reason for this.
If physicians become aware of how their language affects a patient, they can better equip a friendly atmosphere in which a patient can comfortably disclose information. Biological sex and age of the hypothetical physician. This is a limitation because it may change the perceived comfort level of the patient. Also, not knowing the credibility of a physician, and the survey was launched only a week or two before results were collected and then analyzed. Also, not enough people may have completed the survey, and this may have been due to a lack of time participants had, which also limited the amount of information received. We also had a limited source outlet. We only used 2 source outlets, Facebook and the WMU-COM 2010 class list, to find our participants. The type of medical terminology and type of disclosure was not specific enough or was too broad. Future research. Our results indicated a wide age range from 18 to 78. For future research of this hypothesis, we decided that by creating a survey on Qualtrics that specifically targets participants of a single age group could further strengthen the results. This could also improve the data and lead to implications about whether there is a relationship between usage of medical terminology by a physician and self-disclosure by a patient. Also, by narrowing in on a specific age group or a specific biological sex could help find if there is a negative relationship between the overuse of medical terminology by a physician and amount of disclosure from a patient. This survey was only open to WMU students enrolled in COM 2010, current semester, and Facebook friends of Group 4. For future research of this hypothesis, we would make the survey available to a larger geographical area. This would cover a larger crowd of potential participants, allowing us to gather more information to analyze. Creating a Qualtrics survey that gave more specific examples of medical terminology, and this would lead to a better understanding of what a patient qualifies as overuse of medical terminology. And lastly, specifically targeting participants who have experience dealing with doctors and medical terminology would be beneficial for this type of study.